Annabelle.
Hi.
It's nice to see you again. Thank you for coming to the session.
Yeah, thank you for having me.
It's a great way to enhance what you are doing in the mindfulness-based relapse group. So how are things going?
They're going great. I can tell you that I started working again.
Wow.
Yeah, it was different. It was, I was nervous. It was my first time being sober at the job, so it's different. But I was able to manage, and that went great. And also in my personal life, I was able to go have coffee with my mom, and that was great. I'm actually doing the DUI classes too, because I need my license reinstated. I rely a lot on walking recently, so that's different. But it's beneficial, because I also started exercising. I'm running and meditating and, just trying to get my things together.
Wow, that's a lot of positive changes.
Yes.
And how's the group going?
Well, the mindfulness-based relapse prevention is actually going great. I had the opportunity to meet a lot of great people, it's different also because I didn't have that before. I had a lot of people that I could hang out with, but not necessarily people that I could trust, so I'm really enjoying that.
Good.
Mm-hmm.
Now, I believe you have been working on the sitting meditation this week, is that correct?
Yes, that is true.
And how is that for you?
Well, I've been faithfully doing some practice. I've been trying to do it at home, but just, sometimes it just feels like this long pause between things, and I feel somewhat agitated. I want to check the time and the clock, and I'm just like ready for it to be over. So it's a work in progress, I would say.
So, you noticed agitation, it sounds like, and restlessness.
Mm-hmm.
And then what happened next?
I would have the urge to move, or at least shake my head, my legs, and I would get itchy actually. I would.
Oh, bodily sensations as well, okay.
Mm-hmm.
So you're noticing agitation, how that feels in your body, and watching how the mind is reacting. Is that feeling like wanting to move or escape, is that familiar to you?
Well, you know what, now that you mention it, I think so. I remember, at least I remember the pacing. I would pace a lot back and forth after an argument with my ex-boyfriend, and I would actually get itchy too. And then I got to the point that I just couldn't handle it anymore, and I would just resource to drink.
I see.
Mm-hmm.
But this time, you didn't escape in that unhealthy manner. And this is wonderful. This is a good change. As you remember from the group, these mindfulness techniques give you new options. In the past, you probably had two choices when a bad thought or a bad emotion came upon you. One choice was to try to push that thought out of your mind, and that usually doesn't work, because usually what we try to push out of our mind stays even more so.
Mm-hmm.
The other option was to do what you mentioned, just drink your problems and emotions away. So what mindfulness does is give us a third option.
Mm-hmm.
We call it going into, running with your urge. We call that automatic pilot. So we're trying to avoid you running into automatic pilot, which is what you did the other day. You had a third option of just noticing the thought, realizing that's just a thought, it's just a feeling, and I have options. Can you think of ways you might use this technique during your life?
Well, as I mentioned to you before, I don't have my license, so I have to walk everywhere I go. And on many of those walks, I actually ended up passing my old drinking buddy's house, and I would have those feelings, I would feel agitated and feel anxious. So I think I could use this in this situation.
So.
Yeah.
Excellent. Any other ways?
Well, yeah. Now that we're discussing it, I know that we've worked on this in one of our groups, and we do something that's called a sober breathing. I don't know if you've heard of it.
Yes,
but
I have. Tell me more about it.
So sober breathing, it's SOBER, so it's an acronym for stopping, observing the situation and breathing, trying to focus on what's really happening right now, expanding awareness, and responding. So overall, it's being mindful instead of using that automatic pilot. Is that what you said?
Yes, exactly.
So yeah, so I actually used this in, I think it was 2 days ago, when I had the urge to call my ex-boyfriend because I really miss him. You know, we spent a lot of time together. But from our previous meetings, I know it's not a good thing for me. I know that something like that would really make me relapse, and I don't want that to happen. I'm so fearful of drinking again after everything that's happened to me. So I actually did this. I stopped. I tried to take a moment and observing what was going on. I started deep breathing and trying to expand my awareness of the situation. And instead of calling him, I ended up calling a buddy of mine from the group. So yeah.
That's excellent, Annabelle. It sounds like you are putting the techniques and skills that you're learning into practice. That's amazing. Now, I believe this is your 4 months sober this week, am I correct?
Yes, it is. Yes, it is. I'm excited.
Awesome. What an amazing accomplishment. Change is very hard work. You must be so proud of yourself.
Thank you. I am. I really am.
Excellent.
It's just, I am proud of myself, you know. It's just, I'm also very fearful. I've met a lot of people that have relapsed. A really close friend of mine from the treatment center, she relapsed almost immediately after leaving. So it's just, I try to stay positive, especially with the spiritual meditation that I've learned from my shock, but it gets challenging sometimes, you know?
Oh, I understand. I hear that you're feeling anxious about, possibilities in the future. But that's common. That's very common for anyone that's going through all the new challenges and the changes that you're going through. So what are some ways that you could continue on this already successful path that you're on right now?
You know, I think I guess I'll try to continue doing what I was doing before. Well, not before like 4 months ago, like before like 2 days ago, where I called one of my group buddies for support. You know, it's nice to have people there for you. It's different for me, but I'm trying to learn how to accept it. You know.
Speaking of new people in your life, have you reconnected with, I believe his name was Ashok from the reservation? You spoke fairly highly of him.
Yeah, so like I mentioned, I forgot to tell you when I first came in, but I did. I had an opportunity to meet with him, and it was great. He's now my spiritual mentor. I officially assigned him as spiritual mentor.
Nice.
And he actually had a different model or view of alcoholism. He viewed it as an evil spirit, so I like that version better.
Okay, well, as we talked about in earlier sessions, the disease model of addiction is just one way to view your alcoholism. We talked about how transpersonal theory states that addicts are mystics or seekers who are misguided on their search for spiritual wholeness.
Mm-hmm.
So it's different ways to look at it.
Yeah, and I really like that a lot better. I don't want to think that I'm sick or diseased or, it's just awful.
Right, and it sounds like Ashok has also given you another way to define why you drank.
Mm-hmm.
I'm wondering how it felt to reconnect with your Native American heritage as well.
Well, it was actually an amazing experience. I'm actually going to see him at the reserve often. I go to the spiritual temples every now and then, only because I'm busy with work and all that now. But we've been able to go fishing and hunting, and it's like I'm finding myself, It's been great.
Awesome. It sounds to me like you're doing so many positive things and taking many good steps to avoid relapse. I remember the first day that you came into the office, that was your biggest fear, relapsing. Do you remember that day?
Oh yes. How can I forget? It was horrible. I just all over the place.
On a scale of 1 to 10, with 1 being the least anxious and 10 being the most anxious, how do you think you felt that day?
I was a 9. I was very, very uncomfortable and anxious. I had great fear of relapsing, and it was just horrible. I don't want to be in that situation again.
And what about today? What is your anxiety level about relapsing?
Well, to be honest, I want to stay positive, so I wouldn't say it's high, but it could use some work. I'm 3 or 4.
Okay, that's a huge difference.
You think so?
Oh, definitely. I think that's wonderful. I can even see in your face and your body language, you're just less tense.
Mm-hmm.
Definitely.
Yeah, I've been, I've been trying to do things different now. I try to exercise, and despite of feeling uncomfortable with meditation, I've been doing so. I'm not as shaky anymore, so I guess that it is true what the facilitator told me, that it gets better with time,
I think so. And there's an abundance of research on the benefits of meditation, not only for alcohol urges or cravings, but also for reducing stress and for just overall better health. So as you continue to practice, I'm sure it will get easier, like your group facilitator says.
Yeah, I would hope so. I definitely don't want to go back to ever to drink. That was horrible, and I don't want to be uneasy about it. I don't want to feel anxious. And you know what? I think after all, reconnecting with Shashak really helped me, getting back in touch with my roots, and just having a sense of spiritual awareness, I would say. I mean, that's what the facilitator says, mindfulness, meditation creates a sense of self-awareness and self-transcendence.
Awesome.
Mm-hmm.
Well, you're doing great, and I look forward to seeing you next week.
Thank you. So do I.